Throughout history, mankind has faced a myriad of health challenges. One such challenge, persisting for centuries, is malaria, a deadly disease that has been a global health concern. Malaria, caused by the single-celled plasmodium parasites, is transmitted to humans through the bite of an infected Anopheles mosquito. The parasite multiplies in the host's liver before infecting and destroying red blood cells. Common symptoms include fever, headache, and chills, and if not treated promptly, malaria can progress to severe illness, often leading to death. As of now, malaria is endemic in 87 countries worldwide, predominantly in Africa, Asia, and South America. The World Health Organization's 2021 report estimated that there were 241 million cases of malaria worldwide, leading to an alarming 627,000 deaths. This makes malaria one of the deadliest diseases globally, impacting public health on a massive scale, especially in developing nations where access to healthcare is limited. As we delve deeper into the rise of malaria cases in the subsequent scenes, let's not forget the gravity of this disease. Every statistic we discuss represents real people, mothers, fathers, children, who are suffering or have suffered. As we explore the unsettling surge of malaria cases in 2022, we hope to shed light on the root causes, the hidden culprits, the global response, and the road ahead. Stay with us as we unravel this pressing issue, because understanding the problem is the first step towards solving it. Why, despite advancements in health and technology, did we witness a rise in malaria cases in 2022? This question, perplexing as it may seem, is the reality that we grapple with today. In an era where we've seen remarkable strides in healthcare, it's puzzling to see an uptick in malaria cases. We live in a time where technology has revolutionized our lives, where we've seen the dawn of telemedicine, the rise of personalized healthcare, and the evolution of advanced diagnostic tools. We've unlocked the human genome, ventured into the realm of pharmacogenetics, and started tailoring treatments to the individual's unique genetic makeup. Yet, in a twist of irony, the specter of malaria, an age-old disease, has resurfaced with increased intensity in 2022. The World Health Organization, the global authority on health matters, has confirmed this unsettling surge. Their detailed report, a meticulous compilation of data from around the world, reveals a noticeable increase in malaria cases last year. It's a stark reminder that even in our grand march towards a healthier future, old foes can still pose significant threats. This rise in malaria cases isn't just a statistic. It represents people, mothers, fathers, children. It represents communities grappling with the impact of a disease we've long known how to prevent and treat. It's a reflection of the gaps in our healthcare systems, a testament to the inequities that persist, and a call to action for everyone involved in healthcare, from policymakers to medical practitioners. But why has this happened? What are the factors that have contributed to this surge? Are we missing something in our fight against malaria? And most importantly, what can we do about it? These are the questions that we must ask, the issues that we must explore. It is a conundrum that begs for further investigation. As we delve deeper into this topic, we hope to shed light on these pressing questions and explore possible solutions to this public health challenge. Because ultimately, understanding the problem is the first step towards solving it. Numbers often tell a story more convincingly than words. And the numbers from the World Health Organization's recent report on malaria are speaking volumes. The report revealed a concerning upswing in malaria cases in the year 2022. This surge is not uniform across the globe, however, with certain regions bearing the brunt of this increase. In the African region, which already shoulders a significant proportion of the global malaria burden, there has been a noticeable uptick in cases. Home to 90% of the world's malaria cases, this region has seen an unprecedented rise in the disease, with children under 5 years old being the most affected. This is particularly concerning as this age group is the most vulnerable to the severe consequences of the disease. The Eastern Mediterranean region, too, has seen an increase in malaria cases. War-torn areas and regions with political unrest, where healthcare systems are already strained and access to preventive measures is limited, have been hit the hardest. The same goes for Southeast Asia, where urbanization and changes in land use have created breeding grounds for the mosquito vectors of malaria. Now, what's causing this surge? Several factors are at play. Climate change, with its accompanying shifts in temperature and rainfall patterns, is creating more hospitable environments for mosquitoes. Deforestation and land use changes are exposing previously protected populations to malaria-carrying mosquitoes. And let's not forget the ongoing global health crisis, which has strained healthcare systems worldwide, disrupting malaria control programs and diverting resources away from preventive measures. So, what do these statistics tell us? They paint a picture of a world where malaria, a disease we've been fighting for decades, is gaining ground. They highlight the urgency of addressing not just the disease itself, but the underlying factors contributing to its spread. These numbers are alarming and call for immediate action. The global community needs to rally together to tackle this growing threat, prioritizing vulnerable populations and regions most affected. After all, in the fight against malaria, every number represents a life at stake. What could be the hidden culprits behind this spike in malaria cases? The answer isn't as straightforward as one might think. Yes, we're dealing with a complex web of factors, each contributing to this unsettling surge. Let's dive into some of the potential reasons for the increase. First and foremost, climate change. As the planet warms, mosquitoes, the primary carriers of the malaria parasite, are expanding their range. Warmer temperatures and increased rainfall create ideal breeding conditions, resulting in a rise in mosquito populations and subsequently a jump in malaria cases. Then there's the issue of drug resistance. Over time, the malaria parasite has evolved, developing resistance to commonly used anti-malarial drugs. This drug resistance makes treating the disease increasingly challenging, allowing it to spread more rapidly and widely. But it's not just about the mosquitoes and the parasite, it's also about us, humans. Lack of access to healthcare, particularly in remote and impoverished regions, plays a significant role in the malaria surge. Without timely diagnosis and treatment, the disease can quickly escalate, leading to severe illness and even death. Moreover, socio-political factors can't be ignored. In regions hit by conflict, warfare, or political instability, healthcare systems often crumble. Malaria control efforts are disrupted, and the disease is given a free rein to spread. And let's not forget about the pandemic. COVID-19 has undoubtedly strained global healthcare resources, potentially diverting attention and funds away from malaria control efforts. The result? A resurgence of a disease that we have been fighting for centuries. So as we can see, the surge in malaria cases isn't due to a single factor. It's a complex interplay of environmental, biological, social, and political factors. Unraveling these factors is crucial in our battle against malaria. In the face of adversity, the world often unites. And this has been no different in the wake of the unsettling surge in malaria cases. The global health community, ever vigilant and resilient, has risen to this challenge with remarkable determination and resolve. In response to the alarming increase, international health organizations, governments, and nonprofit entities have rallied together to devise robust strategies, allocate substantial funds, and initiate comprehensive programs aimed at combating this health crisis. This is not merely a battle against a disease, it's a fight for health, life, and the well-being of millions across the globe. Major health organizations like the World Health Organization and the Centers for Disease Control and Prevention have been leading the charge, setting guidelines and providing technical support. There's been a renewed focus on strengthening health systems, improving surveillance, and enhancing diagnostic capabilities. The aim is to ensure early detection and prompt treatment, thereby reducing the disease's spread and impact. Simultaneously, governments worldwide have been ramping up their efforts, allocating funds, and implementing strategies at a national level. From strengthening healthcare infrastructure to launching awareness campaigns, the goal is to equip every corner of their nations to effectively tackle this surge. Meanwhile, nonprofit organizations, charities, and philanthropic entities have been playing a crucial role in this global response. They've been providing much-needed aid, from funding research and development of better treatments and preventive measures to supporting affected communities with resources and care. Equally important in this fight are the scientists and researchers working tirelessly behind the scenes. They're exploring new avenues, developing more effective drugs, and seeking innovative solutions to outsmart and overcome this resilient pathogen. In the end, it has been a concerted global effort, a united front against a common adversary. It's about collaboration and cooperation, about pooling resources and knowledge, about standing together in the face of this daunting challenge. Yes, the road ahead may be tough, but the world remains steadfast and resolute. It's a collective effort, a race against time. We're all in this together, and together we shall overcome. The future is not set in stone, it's ours to shape. As we navigate the road ahead, it's crucial to remember that the trajectory of malaria's spread is not predetermined. We have the power to alter its course through diligent preventive measures and concerted global efforts. Moving forward, the World Health Organization's projections indicate that with increased vigilance and effective preventive strategies, we can indeed curb the rise in malaria cases. This is a battle that can be won. The key to victory lies in our hands. The tools? They're straightforward: timely diagnosis, effective treatment, and most importantly, prevention. Prevention is pivotal in the fight against malaria. It involves a range of measures from the use of insecticide-treated mosquito nets, indoor residual spraying, anti-malarial drugs, to the development and distribution of effective vaccines. But these tools can't function in isolation. They need to be complemented by a robust healthcare system that can promptly diagnose and treat cases, and an effective surveillance system to track disease spread and response. Yet it's not just about systems and measures. It's also about us, individuals. Each one of us has a role to play in this global fight, whether it's taking personal precautions to avoid mosquito bites, spreading awareness about malaria prevention in our communities, or supporting organizations that are working tirelessly to eradicate the disease. Our collective effort can create a ripple effect that can significantly reduce the burden of malaria. The responsibility of shaping a malaria-free world does not solely rest on the shoulders of health organizations or governments. It's a shared responsibility. Remember, the actions we take today will define the world we live in tomorrow. So let's make every action count. Let's make every step we take a stride towards a healthier, malaria-free world. Every step counts in our stride towards a malaria-free world. Let's pause for a moment and reflect on what we've learned today. As we've navigated through the silent surge of malaria, we've discovered some unsettling statistics, identified hidden culprits, and assessed the global response. It's clear that the road ahead is challenging, but not insurmountable. The disease, with its deadly potential, is a global threat, but we also hold the power to combat it. We've seen how preventive measures, effective treatment, and timely diagnosis are pivotal in this fight. But it's not just about systems and measures. It's about us, individuals. Our actions can create a significant impact. Personal precautions, community awareness, support for organizations working on the front lines, every step matters. But as we close this informative journey, we need to remember that knowledge is only powerful when shared. So, if you found this video informative, we urge you to share it with your friends, family, and community. Spread the word, raise awareness. Every voice counts in this fight against malaria. And if you'd like to stay informed about such important topics, please subscribe to our channel. Your support can help us continue to bring such crucial information to light. Thank you for watching, and remember, together we can make a difference. Together, we can shape a healthier, malaria-free world.